My name is Osaige Mary. Thank you very much for joining me on my YouTube channel. You are all welcome. If this is your first time of joining this YouTube channel called Ask Osaige Mary, please don't forget to subscribe and don't forget to like this video and don't forget to ask your question on the comment section. You can find my phone number on the comment section where you will have access to my WhatsApp group. And also, if you're a returning subscriber, don't forget to subscribe if you haven't. Thank you very much. Today we'll be talking about a very important topic. Actually, I've been discussing about this topic, but I haven't actually made a video. So I'll be talking about the UK health and care services, also known as the UK healthcare assistant worker visa, or the support worker route to come to the UK. A lot of people have actually asked me, Adosagi, I want to come to the UK as healthcare assistant. I am a doctor, I am a nurse, I am an engineer, I am a farmer, I am a banker, I'm a market woman, I have only SSCE. I want to come to the UK to come and work as healthcare assistant. I want to come to the UK to come and work as support worker. Some nurses have even said that they can't pass IELTS. They have been finding it difficult to pass IELTS. Some doctors have said they cannot pass their PLAB because there is no exam centers, but they want to come to the UK to come and work as healthcare assistant because they heard that the UK government has launches the health and social care visa to come for people that want to come to the UK to come and work. And people have asked me and said, Osagi, what is your thoughts concerning this? Do you think it's a good choice? Do you think it's a bad choice? This video is going to open your eyes on the things that you should know. Actually, July 14, 2020, the government launches the health and care visa to ensure UK health and care services have access to global talent. Now, this health and care visa, or the health and care worker visa that was launched in 14th of July 2020. If you go to their page, you will see that the Home Secretary then, which was Priti Patel, said that we are indebted to overseas health and care professionals for their tremendous contributions, not just in saving thousands of lives throughout this crisis, but for the vital role they play year-round. This new visa is part of our new immigration system, making it quicker, cheaper, and easier for the best and brightest health and care professionals from around the globe to work in our brilliant NHS. Now, that was the statement of the Priti Patel in July 14th, 2020, when this visa was launched. Actually, the Secretary of State for Health and Social Care, Matt Hancock, said, our health and care system has always had a proud tradition of welcoming overseas staff to work, train, and live in the UK, and I am proud that the NHS is a destination for choice for talented people from around the world. Now, that was when the visa was launched, when the announcement was actually made. Actually, the health and care worker visa was launched officially in August 2020. The announcement was made on the 14th of July 2020, but the official launching of that visa was done in August 2020. It allows medical professionals to come or stay in the UK to work with the NHS, an NHS supplier, or in adult social care. The health and care worker visa can lead to settlement in the UK after 5 years if you are employed by an employer in the UK. Now, the health and care worker visa attract carers from all over the world, and carers can also join with their dependent. It means that this visa, you can actually bring your children, provided they are below 18 years, and you can actually come with your husband, or you can actually come with your wife. Now, why am I making this video? This health and social care worker visa that was launched in August 2020 was actually meant to last for just 12 months. It was actually to begin in January 2022 and end in December 2022. Actually, the program was actually structured for 12 months. So, if you look at the announcement, if you go to the page, you will see, you can actually get the link on the description of this video. If you go to the page, the visa is not an everlasting visa. It was structured for just 12 months. Now, how do you come to the UK to come and work as healthcare assistant? How do you come to the UK to come and work as senior support worker or senior healthcare assistant? For you to be able to be employed in the UK from overseas, wherever you are, to come and work as healthcare assistant, you have to be employed by a registered company by the Home Office. And you have to be paid a minimum of £21,400. So it is not everybody in the UK that can employ people, irrespective of the announcement. There are specific organizations, specific enterprise, specific care homes that can actually employ people to come to the UK to come and work as senior healthcare assistants. Because here in the UK, healthcare assistants are being paid 18 to 90,000 pounds per annum. But the senior healthcare assistants are being paid 21,700 pounds per annum. And you can only come to the UK, you can only be employed as senior healthcare assistant to come and work in the UK because according to the Home Office, any employer that is bringing anybody to come and work in the UK to come and work must be paying the person at least £21,400. And here in UK, senior healthcare workers or senior support worker or senior healthcare assistants are being paid £21,700. So for employers to be able to meet with this recruitment, they have to make sure that anybody they are bringing from overseas are being paid £21,700. Now, this healthcare and social worker visa that was announced, that was launched in August 2020 is saturated. Why did I say saturated? All the countries in the world, in Africa specifically, Ghanaians are jumping on this visa. Nigerians are jumping on this visa. Gambians are jumping on this visa. Sierra Leone, Zimbabwe, Cote d'Ivoire, South Africans, Jamaicans, Filipinos, Pakistanis, Indians, they are jumping on this visa. A massive competition when it comes to this visa. The competition when it comes to this visa is overwhelming. As much as the job is there are massive jobs in the UK for healthcare assistants. However, there are limited care homes that are capable of employing people from overseas. Here in Nottingham, where I live, we have thousands of care homes in Nottingham. But not all these care homes are capable of recruiting from overseas because they do not have this, they haven't met with these demands. Out of thousands of care homes in Nottingham, where I live, for example, you will be shocked that it is only 10 care homes or 20 care homes that are eligible or that have met the criteria of recruiting workers from overseas. What am I trying to say? What I'm trying to say is that even with these 20 care homes or with these care homes who are capable of recruiting workers from overseas, there are massive thousands of millions of applications. The point I am driving at is that these care homes do not even recruit directly. They contract out this recruitment to agencies. And the agencies are saddled with the responsibility of bringing just one or two carers from overseas. Most of the time, each care homes are being given one slot or two slots to recruit carers from overseas. And like I said, when we talk about overseas, people that are jumping on this visa, Sierra Leone's, Cote d'Ivoire's, Ghana's, Nigerians, Pakistanis, Filipinos, Jamaicans, they are all jumping on these visas. All African countries want to come to the UK through this visa. As much as it is good for you to come, you have to be wary of scammers. Because there are a lot of scammers now who are collecting money from people and tell them that I am going to give you job. What I was actually doing was actually to teach people how they can apply for this visa themselves. If you are lucky, you get picked. However, some of these agencies end up collecting thousands of pounds, millions of naira just to bring people to the UK. They promise them that they are going to give people to the UK. But let me tell you something. For you to be able to come to the UK as healthcare assistants, you have to be employed by these care homes. And one of the most important documents that you need for you to apply for this healthcare assistant visa is what we call the Certificate of Sponsorship, also known as COS. And without this certificate of sponsorship, even if you have your police report, you have your international passport, you have done millions of courses online, you will not still be able to access this visa. So what most of these agencies do is that they train people. They will tell them to pay 200,000 naira for application fee. They will tell them to pay another 300,000 naira for registration fee. And then they will promise them interviews. So, like I said, anybody that is promising you this health and social care worker visa, you have to ask the person, will you be able to give me COS? Because even people that are in UK are also jumping on it. Because as a student, most of the students now are also looking for this visa. Even people that are living here in UK, people that came to the UK as a student, they are also jumping on this visa. Even this visa, even students that came here to do their undergraduate program, that don't want to go back to their home country, people that came here to do masters for 1 year or 2 years, that do not want to go back to their home country, they are also looking for this visa. Much you that is in another country who are not even in the country. Because most employers that I've seen, they prefer to recruit people that are living in the UK than someone who is outside the UK. So if any agency is promising you to pay a certain amount of money, ask them, will you be able to give me certificate of sponsorship? Because there are some agents who will tell you that they are going to prepare you. The preparation is not the important thing. There are some agents that will tell you, we are going to train you. If a care home wants to recruit you to come and work as healthcare assistant, they don't give a damn about where you train or what you train or what you have done. After all, when you come here in UK, they are still going to train you for 2 weeks. They are still going to give you all the certificates. The certificate that you come with in Nigeria or Gambia, in Sierra Leone or Ghana or Pakistan or Filipinos is not important to them. Because they are still going to train you anyway. What is important to them is maybe you have been working in care settings. Maybe you are a nurse in your country, you are a doctor, lab scientist, you have been working in care settings, you have been working in social care. That is important. That is what is important to them. So what these agencies does is that they end up collecting millions of naira and organize online training for people. At the end of the day, they are unable to give them COS. They will tell them, go and do your police report, go and do international passport, go and do this, go and do that, go and do that. And at the end of the day, they leave them hanging. So what I'm saying is, be careful of scammers, because this visa, this health and social care visa, is not easy to get. Some people are even collecting 8 million. Some agencies are collecting 8 million to give you COS. They are collecting 8 million naira, collecting 6 million naira, collecting 5 million naira to give you COS. If you have the money, fine, you can pay, you can give if you want, because of course they need this money for various processes, assurances and all of that. If you have the money, you can give, but don't just go and give your 200,000 naira, 300,000 naira for application, for registration. At the end of the day, you are unable to continue with the process and your money is gone. So this is the reason why I said people should stop applying for the health and care worker visa. It is more better to come to the UK as a student right now. It is more better to come to the UK as a student. Or if you are a nurse or you are a doctor, you should face your exam. So the point I'm making is that so many agencies are scamming people with this initiative, with this initiative that the government has launched. So many agencies have bring out their own style of how to rip people off. Thank you very much. If you are just joining me, if you're just watching this video, please don't forget to subscribe, don't forget to like, don't forget to share to your friends so that they will be careful. Because you are not the only one applying for this visa. Other agencies are applying, other countries. Nigeria alone has over 200 million population. Ghana alone has over 100 million population. Syria alone has over 100 million population. So South Africa has over 200 million population. Filipinos, Indians have over 300 million population. So many countries are applying for this visa. Don't fall for this cheap scam whereby agencies will ask you to pay 300,000 naira first for application fee, and they will just give you some material to download online, prepare your CV for you. At the end of the day, they are unable to give you COS, because the most important document for you to have to apply for this visa is certificate of sponsorship. So if any agencies is telling you that they are going to bring you to UK, the question you should ask them is, can you give me certificate of sponsorship? That is the question you should ask them. Because some agencies collect money from hundreds of people, thousands of people, but they only have 2 COS slots. So they end up collecting money from more than 500 Nigerians, Ghanaians, South Africans. At the end of the day, they know within themselves that they only need 2 people. So what happened to the rest thousands of people that you have collected money from? You tell them they are not successful. You tell them that the interview they did are not successful. You tell them that, oh, sorry, you were not lucky. We will get back to you next time. We will keep you in our archives. We will keep you in our vote. When we want to employ next time, we will contact you. Months is going on, months and months passing by, you didn't contact them. Meanwhile, the visa will expire by December this year. Stop applying for the health and social care worker visa if you know that you don't have patience and if you know you do not have money. Thank you very much, and don't forget to subscribe to my videos.